Today I'm going to talk a little bit about sort of framing the context for understanding opioid issues in Canada and the U.S. And I think we have a curious situation south of us where, and it may pain my American colleagues for me to say this, but compared to Canada, they're doing quite well. A little slow off the mark and lots of problems still, but compared to Canada on the prescription opioid issue, lots of movement in terms of epidemiology and in terms of action on the ground, et cetera, et cetera. A few disclaimers before really start getting rolling here. There's no financial interest to declare. I'm not being bankrolled by any pharmaceutical company on this presentation, nor is the series being bankrolled by anyone with a pecuniary interest. Interestingly, some data released last week in the U.S., an outfit called Dollars for Docs, suggested that in the U.S. the pharmaceutical payments to MDs totaled about $2 billion in a one-year period. So happy to report no financial interest here. What I will try to do is reflect the available evidence and the wisdom of community, such as it is here in Waterloo region. I don't pretend to be an expert, but I'll share what I've gleaned along the way. And certainly make some comments, but they're not intended to be political or ideological in nature. If we were to assign blame for the mess that we are in, that we find ourselves in Canada, there'd be plenty of blame to go around, and not it would be unfair to point the blame towards any one government or any one sector. The important thing, I think, is we know enough to move forward. We know enough that we should be doing better. Critical question is, what's next? And as I mentioned, I'm going to compare Canada to what's happening in the U.S. It's going to be a little bit Ontario-centric in terms of the Canadian content, but what we do know in Canada is a very, very slow response, and it's been more than 10 years since overdose rates in Ontario quintupled. And if we'd had a data monitoring system, a real-time monitoring system like we do for other diseases, it would have been screaming at us 10 years ago. What's clear is really a lack of leadership in Canada. There's no one body that's responsible or that has stepped up, or there's no one body that has jurisdiction on, for this mess that we find ourselves in. But just to be fair to the Americans, America has about 5% of the world's population, and they are the most incarcerated nation in the world, and drugs are a key factor in that, as are mandatory minimum sentencing. The U.S. Consumes about 70% of the world's opioids. That's rather huge. Most of the hydrocodone supply, and has a huge domestic opioid market valued at about $11 billion. And as of, I think, 2009, accidental overdoses became the leading cause of accidental death in the U.S. for the first time, exceeding motor vehicle collisions. And the L.A. Times did a review and determined that someone dies accidentally every 14 minutes. But we shouldn't be too smug here in Canada. I note this article from, ironically passed to me from dear friend Kirsten in Scotland. And I think this was the only media outlet to pick it up out of Saskatoon, the Star Phoenix, and they reported on some INCB data that noted that as of 2010, Canada has surpassed the U.S., and we are now the leading per capita consumer of opioids in the world at rates much lower than other countries around the world. It's not, third place isn't even close. It's about, I think it's, where is it? Anyway, it's not even close. A couple of things as we move through this. I think this will be, at least some of it will be a surprise to most Canadians. We often think of addiction in terms of, those people, this stereotype that we have of sort of street-level junkies, excuse the language. And I suggest to you that's absolutely a misguided stereotype, that those at risk of dying include citizens using exactly as prescribed by their medical doctor, often with a mental health medication, but not typically high dosages of opioids. And for that reason, I highly encourage you to tune into Trevor Corneille's presentation out of Interior Region BC. They've done a coroner review, and I think it'll be an eye-opening experience for most Canadians in terms of describing who's at risk of accidentally dying. And of course, it also includes citizens using from the black market, untaxed, unregulated. It's worth pointing out that stereotypes, bias, and judgment really are significant barriers to ensuring health and safety at all levels, and it happens in and outside of primary care. And as my good friend Betty Lou said, people don't realize that those stereotypes and those judgments are killing people. But when we withhold critical health interventions like naloxone, for example, like other forms of medical interventions, health and social services, et cetera, et cetera. And I often say to people, even if you're indifferent about the value of human life, there's a financial imperative to get serious about these kinds of issues. Should also point out, if it's not fairly clear already, that the criminal justice system is it's an expensive proposition. To lock someone up in Ontario, it's probably $100,000 a year. That buys you an awful lot of services and reduces, if we can swim upstream a little bit, it would reduce the potential for victimization. It's a very blunt instrument that many have pointed out, and the Canadian Medical Association Journal just ran a series on this, that's ill-equipped to ensure health and safety of people. And whether you're doing 6 months or 2 years or 5 years, eventually you get out. And there was a time when the justice system was more about was more than just vengeance or seeking justice. It was about rehabilitation, and there seems to be an absence of those kinds of measures going on in the Canadian correctional system. And finally, if it's not clear by the end of this presentation, I'll tell you right now, it really does appear there's no leadership, no adults in charge. And if we're looking for one magic solution, I suggest to you that it's a rather futile search, that it'll take a community of interested people to step up and turn the situation around. And that would include the leaders who are on this webinar and those to follow. You are leaders compared to many in your community, and I hope the webinar series provides good value for you and you're able to share and move forward. Any positive change, as they say in Chicago. We did a review, and in particular Rachel Schumann out of the research shop in Guelph, not too far from us. It was our hunch that overdose prevention strategies weren't showing up in major strategic documents, and Rochelle reviewed 45 documents, most in the last 5 years, so well after the opioid crisis was underway. She looked at governments at many levels. She looked at professional associations and advisory agencies like the College of Physicians and Surgeons, like the Canada Centre on Substance Abuse, like the National Anti-Drug Strategy, like the provincial drug strategies, et cetera, et cetera. And what was glaringly absent in a very curious response was overdose prevention and intervention, and in particular naloxone. It's a really curious response, because it strikes me that when it comes to reducing harms, well, we ought to start with reducing the death rate, and these really are preventable deaths. We know this from the evidence in the U.S. and elsewhere. What were present in those documents were what we call higher order systems of control, and those are things like narcotics monitoring inside pharmacies, tightening restrictions and regulations around medical doctors, that kind of thing, all of which is important, but we know that those higher order systems, they're expensive to implement, they're time consuming, and they don't always work. They have these unanticipated impacts. None was more prevalent than, in terms of a higher order system of control, than the change that happened about a year ago in Ontario. We had a bit of an issue with Oxycontin, and it might have been a full year ago to this day that a note crossed my desk from the executive branch at the Ontario government saying, well, we're delisting Oxycontin in 2 weeks, and we're going to move to new medication delivered by the same pharmaceutical corporation, Purdue Pharma. It's called Oxyneo, to be tamper resistant, et cetera, et cetera. So 2 weeks notice, and it struck many in this community that mitigating the negative impacts was really an afterthought. And at the Crime Prevention Council with my colleagues in the Guelph-Wellington drug strategy, we convened a couple of forums, and we asked service providers and people who are active in their use, and people who had used to use substances, what they thought would happen. And this is what they thought would happen, and these are the headlines that we saw following the Oxycontin decision. We saw heroin emerge into our town. when it wasn't really a huge issue before. We saw what appeared to be a rise in accidental overdoses. We saw strong uptake of fentanyl-related deaths, et cetera, et cetera. And you know, paying attention a little bit to the U.S. media and the Canadian media, I remain dumbfounded by the inability of many to comprehend the basic economics of removing one addictive substance from the marketplace. We know that people who are addicted or dependent on substances, and opioids in particular, you know, if there's one thing you want to avoid in life, it's withdrawal. And there's the police chief of Peterborough down in the bottom left there, but one of his colleagues, I think, said it best. You know, what do you do when one grocery store closes in your town? You go to a different grocery store, and that's exactly what many who are picking up from the illicit market have done. And I think about a year ago I said, you know, great time to be a heroin dealer because the market has just opened up. Anyway, these are the kind of headlines that we're seeing locally, and they haven't stopped. It's a curious response because in the U.S. They were the first country to, or first North American country to delist Oxycontin and introduce Oxy Neo. And this is from the Journal of New England Journal of Medicine. And it was the sample was people who were entering treatment, and what they found was most people had, prior to entering treatment, had already switched to another opioid, primarily heroin, and that's what's happening here. We also saw the emergence of this, which we hadn't seen before. So we started to see overdose alerts from Peterborough Drug Strategy in this particular case, and then locally from the public health unit here in this town, warning of increased risk of overdose. It was a problem before, it's still a problem today. So let's look at some of that U.S. data that I talked about, and there really is no comparator in Canada. I'm not sure if folks are really paying attention, if the data is being collected, certainly not being disseminated, not to the quality that comes out of the Center for Disease Control. And in this graph, you can see the green line at the top is opioid sales, the red line is opioid deaths, and the blue line is opioid treatment admissions in the U.S. For a considerable period of time, and look how they dance together. I would suspect the same thing is happening in Canada. I haven't seen any data. I don't know if anyone is collecting it. And I wonder, that's a curious thing. Is it back to those stereotypes and stigma about who we think are at risk of dying, who are using opioids? Does that transcend at a broader systems level into, you know, basic epidemiology? When you compare it, you know, opioid-related deaths to other forms of disease like car accidents or H1N1 and HIV, we have a much richer source of data collection and dissemination going on. And of course, you know, this is key data for moving forward on solutions. As I mentioned, motor vehicle collisions were exceeded by drug poisoning, accidental overdoses in the U.S. It happened, I'm trying to find my graph here, but I think it really passed in 2008 and 2009 and hasn't looked back since. In Ontario, accidental overdoses, at least as of 2007, we're claiming that it's the third leading cause of accidental death. Falls #1, motor vehicle collisions #2, and then accidental overdoses. Within that, prescription opioids are a major substance of concern. That rate has likely gone up since 2007, but it's the freshest data that we can get our hands on. Good news, about a year ago, the Ontario Ministry of Health promised real-time monitoring in 73 emergency departments around Ontario and some timely coroner data. We haven't seen much emerge, but it's particularly why I'm excited for Dr. Kieran Moore. He finishes our webinar series on the 25th of April, and he'll talk about a real-time monitoring system that might work for Ontario, if not for Canada. Move to the next slide here, and you can see where the causes of death are happening amongst opioids and other substances. You know, it's prescription opioids, no surprise there. I think they exceed heroin and cocaine combined. I suspect the same thing is happening in Canada. We often think that it's a stereotypical drug dealer on a corner, on the street dealing this stuff. But data from the U.S. This is 06, which show that most people got the opioid from a friend or relative, and most of those, 80% of them, would have got it from one particular doctor. So we know an addiction, often starts in a medical office, and too often it finishes in a coroner's office. And in terms of counting overdose deaths and injuries, the fact that we have such a lack of data in Canada is really curious, considering everyone who dies has been seen by medical experts all along the line here.